Hi, and welcome to Chapter 11, Surgical Sepsis. Throughout this chapter, we will deal with how to properly disinfect, how to set up for establish a sterile field, how to open sterile packs for some of the procedures that we're going to do. The nice thing about this chapter, other than the definitions that you need to be aware of, there's a lot of videos that I've linked you to that will show everything that's in this chapter. So I'm not going to lecture for very long because the videos really do a nice job of explaining what you should be doing in that certain situation. So I do want to remind you of the term medical sepsis, which is methods of reducing pathogenic microorganisms in the environment and reducing the spread of those. Surgical sepsis is just where you're maintaining a sterile field. So we're creating an area that's free of those pathogens, and then we have the sterilization process where we want to destroy those organisms and spores from our equipment and patient care exam areas that we're doing certain procedures in. So we do have that chemical sterilization where we're soaking or cleaning objects in a bath of solution. So you're going to see these containers. They're going to have a sterile water rinse that follows after they've been sitting in that solution. So we don't recommend this for surgery area. So it's a less effective way, but sometimes you'll go into a doctor's office and you'll see instruments being soaked in this solution. You'll also notice the autoclaves. Those will be in the surgery area, so your surgical techs will definitely use these. You will see these in urgent cares where it's a steam sterilization pressure method that will use heat and moisture to sterilize the equipment. So you may work in a facility that you're asked to operate the autoclave unit, and they're pretty user-friendly, so they're not a difficult device to pick up on if you do end up getting a job where they're saying, okay, you have to use this piece of equipment. So you basically push a button and it will set to an amount of time with a certain temp range, and it will take care of that for you. So don't worry if you get a position in an area that you're required to do some duties outside of what you were taught as a radiographer. So you're not going to see the autoclave units being used at the hospitals in that setting where you are going to be doing your internship. So it's not something that you're going to be operating in the department. Some things to know: if you do have a device that you're sterilizing, that chemical indicator, there's a label on that package that will change color when sterilization has occurred. So you'll be able to identify, was that pack sterilized. They will typically date it and put the time stamp on it as well in some facilities so that you know when that package was done. So you'll see here's a tag. So your sterilization turns these black lines on this tag right through here. It has a tab that identifies what's in that container. You'll also see the sticker with the date and time. Your sterile field is just an area that you're going to prepare to keep areas sterile during a certain procedure. And so you'll have a sterile tray that you'll use during certain procedures such as myelograms or arthrograms, those types of things. So if you do have a sterile field, you're going to place the pack on a clean surface so that the physician can grab what pieces of equipment they need. So before the procedure begins, you're going to break that seal, you're going to open up the package, and I just want to remind you that that first corner is always going to be away from you, and then you're going to unfold those two sides, pull that front fold down towards you and drop it, but don't touch the inner surface. So that inner wrap, remember that that's the sterile field, so you don't want to touch anything inside that area. And so I have some nice videos that show you how to open up those containers so that you're not touching anything. So make sure that your arm's not falling in the field, that you don't contaminate or break the seal before it's to be used. Do not pass anything over the sterile field, and you shouldn't leave that sterile field unattended so that it doesn't become contaminated. Just remember, about a 1-inch border of the perimeter is considered a buffer zone, so that area you can touch. And you'll see another video that I've posted that shows you how to drop contents on. Just when you're dropping contents onto the sterile field, it's about 6 inches from the field and at a slight angle so that that drops into that area and you're not touching it. Then you can establish a sterile field drape that you place on your patient, and we do pour solutions into a basin for them to use. So I have a couple videos for you to watch on that. If you're prepping skin, sometimes we do have to shave the area to get rid of the hair, and so those are typically in the kit. So when you open up the kit, you'll see all of these devices that you need for that particular exam, which is really nice for us because we just open up the container and then everything we need is right in there. So some of the things to keep in mind: you may have to shave an area. You're going to put a sterile gauze sponge wetted with alcohol to help remove any air or hair, and you're going to perform hand hygiene and down your sterile gloves when you're touching anything inside that contaminated area. You're going to make sure that sterile drape or towels that the physician's wearing are going to be draped and prepped. So open the package so that it's within an area that they can grab, and again, watch those videos that I have of doing that. If you're doing a surgical hand scrub, there's a video that shows you how to do that appropriately and how to wash your hands. So make sure that you're really paying attention during that video as well. So I'm not going to go through all of this because there's some nice videos that I want you to watch that show you how to put on your gown appropriately, how to put the gloves on appropriately, and if you're already sterile, how you put your gloves on over a sterile glove. And then so make sure that you pay attention to how those are done and the keywords that they're using, with one hand grip, cuff, fold of glove over opposite hand. So pay attention when they're walking you through, how do I open up this glove and put those on without contaminating the gloves. If you do have to do a removal of a dressing, there's also a video that shows you how to do that. Just make sure that you're not hurting the person, that you're not removing the dressing that's going to contaminate yourself. Make sure you're wearing gowns when you do this, and then make sure that you're covering it back up afterwards. So we don't typically remove any dressings, but if you do have to for a certain procedure, then just make sure that you're keeping yourself safe in addition to the patient themselves. So again, watch these videos, especially about the PPE, and that will kind of sum up this chapter nicely so that you have some good visuals of what you should be doing in that circumstance. All right, have a great rest of your week. Thank you.